Hello, everybody. Thank you so much for being here today. I'm really excited to walk you through the project Pharmacotherapeutics and Sensorineural Hearing Loss, a scoping review, and also a discussion of research protocols. This was a really collaborative effort, and I just want to start by giving a quick thanks to the audiology and otolaryngology head and neck surgery departments at the University of Colorado for the support in helping us in the project. So I think hearing loss is something that is not talked about as much, especially considering how common it really is, and yet the available pharmacologic treatments haven't kept pace with the needs of the population. So our goal was to dive into that gap and see what's actually out there and what might be on the horizon. I'll walk you through not only our findings, but how we structured the review so that it can be easily replicated by other student researchers who want to do something similar. Start laying some groundwork. Sensorineural hearing loss, or SNHL, is the most common form of permanent hearing loss, and it affects about 23% of Americans age 12, and that number is only expected to grow. This type of hearing loss, etiologies of sensorineural hearing loss, it can be congenital, acquired later in life from things like exposure to loud noise, ototoxic medications, or aging. So it's a big umbrella diagnosis that affects people at every age. And right now, treatment mostly centers around assistive devices like hearing aids or cochlear implants. And those are great, but they don't restore hearing. They just help work around the loss. And cochlear implants, people say it sounds like you're speaking to them from a tin can. So there's that as well. So there's a clear need for actual pharmacologic therapies that can either prevent, treat, or potentially even reverse this type of damage. And that's where our study comes in. So what did we want to do? The objective of our review was to take a wide angle lens to all the pharmacologic therapies, whether they're FDA approved or still in clinical trials that are being looked at for treating SNHL. And we didn't want to limit it to just published treatment or even just the successful ones. We included promising ongoing trials and experimental therapies just because understanding where the field is heading is just as important as knowing where it's been. And our aim was to give clinicians, researchers, and honestly anyone in the field a map of what's out there so far and maybe help guide future work. Now let's talk about how we went about it. We followed PRISMA SCR framework, which is an extension of the PRISMA guidelines that's specifically tailored for scoping reviews. So it's not just about summarizing existing studies, but it's also about identifying gaps, categorizing themes, and guiding future research directions. We also registered our protocol on the Open Science Framework registry, which is just good practice, adds to transparency of the whole process. And this registration was completed in October 2024. So anyone who wants to check our work or reuse our structure can go on the OSF record and see exactly what we did. In our search strategy and database, we cast a pretty wide net for our lit search. We used PubMed, Embase, Scopus, Web of Science, and even Google Scholar for a bit of gray literature. Altogether, we identified a grand total of 2,592 studies. And one thing we did that I think helped a lot was hand searching and adding 19 relevant articles post hoc, which included mostly clinical trials that hadn't yet been published, but were listed on clinicaltrials.gov. And after duplicates were removed, we were left with 2,040 studies for screening, which brings us to the next phase. And of those 2,040 records, 247 were selected for full text review. 68 studies were ended up in full text analysis. And we excluded studies for, reasons like having fewer than 5 patients, being review articles, or simply not being relevant to SNHL. And to manage this, we used RAN, which is an online platform specifically designed for systematic and scoping reviews. It allowed for multiple people to screen, simultaneously compare results, which kept the process organized and efficient. And our work division was divided into stages, and everything was clearly set from the start, where we had our stage 1, which was the title and abstract screening and creating rotating reviewer pairs. So we made sure that 2 sets of eyes were on one article each time. And then we went into stage 2 of full text screening. And then there was a conflict resolution and oversight, which involved a third reviewer if there was incongruency with decisions on the articles wanted to be included. And one very important thing in this process was also assigning authorship roles following ICMJE authorship criteria. And this is our Prisma flow diagram we use to track every step of the process visually, and something we'll include in the final paper as well, which, as we see, the 68 studies down at the bottom and our 19 post hoc studies are included there as well. Once we had our final batch of studies, we needed a way to organize them that in a way that would be meaningful for clinicians and researchers. So we created 6 main categories based on mechanism of action, and those were antioxidant, steroid-based combination, hematologic-based, pathway modulator, regenerative therapy, and gene therapies. And as we can see on the chart, there's fewer and fewer that is going along the line here, but what remains the most common is the steroid-based therapies as well as antioxidant, which we found most common was N-acetylcysteine and dexamethasone-based therapies. And interestingly enough, gene therapies are not as common now. Some of the highlights we've found include the approval of PEDMARK, which is a sodium thiosulfate, and currently the only FDA-approved drug to prevent sensorineural hearing loss in certain pediatric cancer patients, and that's a huge win in this space. We also saw some very promising early trials using gene therapy. Specifically, it is abbreviated as AAVOTOF vectors targeting congenital sensorineural hearing loss caused by otoferlin gene mutations. And these had surprisingly good outcomes in small sample sizes, and then we found a strong signal supporting intratympanic steroid injections, especially when combined with hyperbaric oxygen therapy, which of those 68 studies, that comprised actually the vast majority of those. So that seems to be one of the favorites in treating and preventing ototoxicity, and as well as idiopathic sudden sensorineural hearing loss. And of course, no study is perfect. Ours has limitations as well. We excluded animal studies, case reports, systematic reviews, and we also didn't include therapies that failed to meet primary endpoints in trials. But that in itself shows a gap, as many studies lack long-term follow-up, standardized outcome measures, or well-documented delivery methods. For example, the blood labyrinth barrier prevents a major pharmacokinetic challenge that is rarely addressed. So even though we excluded some of this content by design, we highlight it as a key area that future studies should explore. And one thing I really want to stress is how we divided the work in this process. It was quite a large undertaking and a large team. So one of the roles I have taken on within the past year is more of a research mentor and educator for upcoming medical students that have no experience within research. And so the latter half of this presentation is my own personal take on research protocols and getting medical students involved in research early. And so it's my opinion that if you're doing a scoping review or trying to publish more regularly, having a clean protocol for collaboration is key. And in our case, one person handled all the OSF registration and documentation, and another led the search strategy design. 4 of us handled all the screening and data extraction, and it was all on one source that we could all look at. And this workflow helped keep us organized and made it easier to onboard new collaborators for future students who want to contribute. And now for this last part, I'm going to discuss the algorithms essentially for medical students trying to gain research experience in publications, which following based off of our study that we finished there. We recommend starting in systematic reviews, meta-analyses, or scoping reviews, as these are arguably the most efficient and high-yield approaches. The process begins with identifying clinically relevant question and ideally one tied to your future specialty of interest. From there, protocol is developed and registered through Prospero or OSF, followed by a structured database using a platform like PubMed, Scopus, or Embase. And then you screen the studies, and we recommend using a tool like Rain, which is free to use for students. And there's upgradable versions that are much cheaper than other platforms. And when well organized and divided among collaborators, this method is a replicable framework almost like a little research conveyor belt where you can generate multiple published projects with statistical rigor and long-term clinical relevance compared to one-off case reports or retrospective chart reviews. These reviews do have broader impact and contribute to line development, especially if they're tied to therapeutic outcomes, surgical techniques, or diagnostic methods. And this model not only produces publications, it also teaches leadership, scientific literacy, and strategic thinking. You learn how to delegate roles, synthesize large volumes of literature, and apply statistical and clinical reasoning across data sets. And additionally, you're producing your future field of interest, which is your focus CV rather than just scattershot of multiple disconnected case reports. And of course, there's always trade-offs. These reviews require patience, a lot of team coordination, and some initial mentorship to get started. And they also lack the novelty that original bench research or case discoveries provide. But in an era where medical student research often feels transactional or superficial, systematic or scoping reviews can offer depth, scalability, and the ability to ask big picture questions. And if done right, they can position you not just as a participant in research, but also a driver of it. And so that wraps up our review. And thank you again for listening and giving attention to a topic that I love to talk about. And I'm happy to answer any questions. Here's my email. Or if you're thinking about doing any similar projects, I'd love to share tools, templates with you so we can keep the momentum going. Thank you.